Hello, and welcome to the Neurology Nuts and Bolts podcast, a podcast all about constructing your career in neurology. I'm your host, Sagari Betté, a movement disorders specialist at the Parkinson's Disease and Movement Disorders Center of Boca Raton. Today, as part of the Work, Life, and Wellness series, we are going to be talking with Dr. Sara Schaefer, Assistant Professor of Neurology at Yale School of Medicine and the founder of this podcast, and Dr. Kathrin LaFaver, a neurologist in Saratoga Springs, certified in lifestyle medicine, and co-founder of the Women Neurologist Group, WNG, about handling unexpected family health issues. Thank you for joining us, and thank you for taking the time to speak with me today, Sara and Kathrin.
Thanks for having us.
Thanks.
To dive right in, I'd like to invite each of you to share the unexpected health issues that arose in your lives to the extent that you feel comfortable doing so.
I can start. So I had my second baby in February of 2020. So not the best time, right before the pandemic hit. And we didn't know that anything was wrong with her until she was about 5 weeks old. And then it was clear that she had significant medical problems and ultimately required a surgery. She has biliary atresia, so she was going into liver failure. And I was still on maternity leave when she had her surgery at 7 weeks, and then went back to work over the summer. And it became clear over the summer that the surgery didn't work to the extent that we wanted it to, and she quickly progressed to liver failure and cirrhosis and needed to be listed for transplant. So she was in and out of the hospital and then in the hospital for about 3 months. Ultimately ended up at a hospital more than 2 hours away from where we live. So that's kind of the long and short of it. It was a surprise and a long haul.
Yeah, so I think my story has a lot of similarities with Sarah's. My health emergency or family health crisis also arose when we had our second child. Our son was born in 2015. Similar to Sarah, there were no problems predicted during the pregnancy. But soon after he was born, he was about 3 weeks old, he started having seizures. And being a neurologist, I might have detected those earlier as possibly another person would have, because they were pretty subtle. And then, we kind of contacted a friend, a pediatric neurologist at my institution, which led ultimately to an MRI and a diagnosis of polymicrogyria, which ultimately has led to ongoing seizures and quite significant disability.
Thank you both for sharing. So to put these in context of your lives at the time, what were your careers like and your lives like before and immediately during these events?
Well, I was at Yale as an assistant professor of neurology. I was also serving as the associate program director for the residency and the fellowship director. So I had a number of hats, and I was working full time, and my husband was working full time, and we also had a 3-year-old son who was at home with us a lot more than we expected him to be because of the pandemic. And, I took my maternity leave as expected, and then I went back full time. We didn't know yet what was going to happen. She got admitted a few times over that summer. Each small admission kept turning into more days and more days. And I found myself sometimes sleeping with her at the hospital and then waking up in the morning, putting on my work clothes and walking across the street to clinic. And I was just in survival mode. I met with the leadership. I let my vice chair know, who was also my division chief at the time. I let the clinic director know what was going on. I was very open with everybody about it and with my colleagues, because I knew that I wasn't going to be working at my normal capacity. And I was very lucky that I had been at the institution for a while. And so I think people knew that I'm not a slacker, that I'm not going to, make up excuses to not do my job. And so there was an enormous amount of support. And actually one of my supervisors was the first person who said, "Do you want to go part-time?" And I was like, no, it's fine. No. And then a couple weeks later, I was like, yes, I do. Yes. And so I went to 70% FTE actually the day after she got admitted for what turned into a 3-month period of time when she got transferred to the other hospital and got listed for transplant and ultimately got her transplant. I pulled out of all satellite clinics. I had been going to a couple of different clinics around Connecticut. And I said, I just want everything to be as simple as humanly possible. I consolidated my clinics to Monday and Wednesday so that I could travel to Boston from Thursday to Sunday. And so my husband and I ended up switching twice a week. And they just took me completely out of inpatient time, no questions asked. The program director stopped asking me to do things. I mean, everybody just pulled back, and I stopped saying yes to everything. I mean, I didn't do preclinical workshops. I didn't review papers. I said no to everything, and I just simplified everything as much as I could.
Yeah, so in my case, when my son was born, I had just been promoted to the director of the movement disorder division at the academic institution I was working at. I had started there my job 2 years earlier as actually the only movement specialist. So I was busy and I was doing all the things, right? In addition to seeing a full clinic on most days, I was quite heavily engaged in research trials, in teaching, inpatient work, all the things. And so I was just going on maternity leave for about 6 weeks as I had planned, and I came back, and so then some seizure history unfolded. And so I didn't immediately change my workload or my trajectory per se. And I think part of it, my son was physically healthy, other than the neurologic issues, which was mostly the seizures. And otherwise he was just a tiny little baby. So my husband is a stay-at-home dad, and was since our daughter had been born 2 years before that. So he was really taking the majority on of the work and doctor's appointments that had to be done. I would occasionally obviously go to a doctor's appointment, but there wasn't sort of this immediate need for to high time demands on me. I think, and we'll come probably to this a little bit later, I mean, of course, I was sort of, thinking about the future a lot, getting sort of this life-altering diagnosis. Your child has a, incurable neurologic illness. It obviously got me thinking a lot about what is his future going to look like? What does that mean for our family? But in the immediate circumstances, I did actually continue my academic trajectory, did ultimately end up a lot of traveling, attending conferences, giving talks, and really putting a lot of the burden of caregiving on my husband.
Do you think, or did you feel at the time that you had truly accepted this change? What I mean by that is that as physicians, we're so focused on our work. We've done years and decades of training to become specialists and focus on our patients in a way that is or can be very unilateral. So to suddenly take a look at the focus and think, oh, is this different? And am I truly okay with this difference? Have I accepted it? How do you think you went about that process?
That's a great question. I did a lot of soul searching. I've always been an extremely motivated person. I'm always trying to do a million things. I had this idea of what my career was going to look like and when it was going to look like that, just pushing, as many of us do. And when I realized that I couldn't do that, that I had to take a period of time, and I didn't know how long that period of time was going to be, right? I had a crisis. I was like, oh, but I had this whole idea of myself and what are other people going to think if I'm not doing, what I usually do. And if I'm not succeeding in the way that I feel I need to succeed, and I'm letting my patients down. And I mean, it was the whole thing, right? And I ultimately came to the realization after talking to some other people that, and this may seem obvious, but, we have our whole career, right? We have decades of career. And one thing that this podcast has helped me realize is how much your career can change over those decades. And okay, I can still have these goals if I decide at the end of all of this that those still are my goals. But those goals don't need to be now. They can be later, and that's okay. And as far as feeling like my colleagues were going to be bitter, that they had to cover for me, or that my patients were going to be annoyed that they had to change their schedule or go to a different provider, I realized with all the feedback that I was getting that this is an emergency. And we are in a profession of empathetic people, right? Their job is to be empathetic, right? And I got nothing but empathy. I mean, people were like, I'll cover your clinics anytime you want. And I'm like, you're an epilepsy doctor. I'm movement. I don't think that's going to work. And they're like, I'll do it. I'll do it anyway. I mean, people wanted to help. They really wanted to help. And I was just so grateful.
That's great to hear, Sarah. Yeah, I think for me, again, it was a bit of a different trajectory, and it wasn't after we had initially adjusted to this new reality. The work of raising this child was initially not that different from any other child we would have had. So for me, I think it became, as time went on, things did change. So I actually initially enjoyed some of the flexibility life in academic medicine can bring. And as Sarah was saying, sometimes you don't have 100% clinic, right? I did have some protected time actually for research, which allowed me for some flexibility with needs that were arising. In my case, the Children's Hospital was also just directly to my workplace. So if he needed some admission for like an EEG monitoring, I can kind of relate to what Sarah said, staying in the hospital overnight, going back to work the next day. So it sounds very familiar. But overall, I felt we were doing fine. We were coping well. We had a lot of resources, at our fingertips. And then actually, then our son was 4 years old in 2019. I actually made a transition for my career and joined a larger academic institution where I kind of took on a role to kind of build a program for functional movement disorder care and research. And I was kind of ready to dive in and actually, focus more on a subspecialized niche within what I was doing before. And then the pandemic hit. So similar to what Sarah was saying, it was sort of for me, it was bad timing. I moved institutions about 6 months before the start of COVID. Everything shut down. So it became very difficult, honestly, to navigate and manage. And after we did that for half a year or so, that got me to a point where really we evaluated things, and my son had no care at all. So the schools all went virtually, and we had to log him into a computer, a Zoom monitor in his wheelchair. He has cortical vision impairment, so that just didn't make sense. He couldn't even see anything on that monitor, but yet we had to log him in for an hour each morning to not lose a spot in the school. So there were just sort of some major irritations that arose over time that added up, and in addition to other issues in my life, ultimately led me to make a quite dramatic career change yet again, and leave academic medicine and join a community-based neurology practice.
Now both of you are back at work, Sara full-time, Kathrin at your community-based neurological practice. Do you feel that how your work responsibilities are structured now is more favorable to your family situation?
Yeah, so I did 70% FTE for at least a year, and then I kind of creeped up to 85%, and then finally only a couple months ago went to 100%. And that's because there was so much unpredictability to my daughter's illness, even after transplant. She did really well for a year, and then, her hemoglobin's 4. She needs to go to the PICU. We don't know what's going on, like those kinds of things. So I didn't feel comfortable creeping back up earlier. I want to say that, after her transplant, after like the biggest thing was over, right? I was talking to my therapist, who I started seeing during all of this, and said, okay, well, it's over, and I should get back on the horse, right? I should start saying yes to everything. And she was like, whoa, you need time to recover. And she was absolutely right. Like like it was a trauma, right? And I needed time to just not worry about going full tilt right away again. And I was also, spending time talking to 3 different pharmacies and referrals and 2 different hospitals. And she was seeing like 6 different subspecialists, right? So I was doing all that too. And I just didn't have the mental energy to go back fully before I did. Now that I'm back full time, I do feel like things are good. I timed going back full time to when she started school, and we had not sent her to daycare before that because of concern about infection. And my husband also is a stay-at-home dad now. He wasn't before all of this, but now he is. And so, yeah, I think it's good. The other thing, as a side note, that I realized is that when I went 70%, I was actually at 110%, which I had not known. And good thing to keep track of when you're in academics, right? Because they won't tell you. So I was able to drop more clinics, and I have less clinics now than I did at the beginning.
Yes, I've been in my job now in a community-based neurology practice for a little bit over 2 years, and it's definitely been a better fit for my family, and just because of me being home. And the thing that I've said most no to is really the travel, conference attendance, giving talks, and I was so in demand, and I think part of it was really subspecializing on a niche topic. So I was just in these past 2 years before my transition, talks also went virtual, and it was just a lot, and I had difficulty saying no. So I was just always preparing for a talk, trying to write on a research grant. I was always kind of working overtime, whether it was nights or weekends, and those things, are gone now. So it's just been a lot easier to find time to spend with my family and also support my husband more than I was able to previously. Now, despite all that, so I have always worked 100%. And again, as Sara said, that means very different things in academic medicine sometimes, because these percentages do add up. And, we're all passionate, driven people. And, sometimes our jobs don't feel like jobs. jobs. It feels like passion projects, right? And we love what we do, but we all just have 24 hours in our days, and sometimes it just time, it takes some time to realize that we can't just give and give and give and have very little left for our families. So yeah, I would say my new job has also been amazing in making last minute changes if I need to. My son has had some long hospital stays. There have been definitely challenges, and with my current job, it's just easier to navigate them because there's less unpredictability in my own schedule.
I know we've been talking a lot about your careers. I did want to shift gears a little bit and ask you both how you navigated this dual role as the physician with the most medical knowledge in the family and as the caregiver, the parent, the partner in your lives.
This was also very challenging for me at the beginning because I felt like it was a life or death situation for my daughter. And I felt like I needed to bring the medical expertise to the situation and advocate for her in every way that I could. And, so I spent a lot of time on PubMed. I was a very annoying parent to her doctor. Anyway, eventually I had to realize that, I'm not an expert in pediatric transplant hepatology, and I never will be. And she has pediatric transplant hepatologists at 2 institutions who know what they're doing and have the experience. And I can know the information and have it at hand, and I can interpret all the medical stuff for my husband, but I can't be her doctor. So that was one thing. And then, the other thing is that my husband, as Kathrin's was a stay-at-home dad, and so he was bringing her to a lot of her appointments, and I was trying to call in and things like that if I could between patients. But I did feel a big responsibility to be there in order to hear what all the doctors had to say, to ask all the right questions. I knew the system and worked within the system. So even just getting the referrals people to approve something, I felt like I was far more capable of doing that than he was, let alone, she had an NG tube for a long time and she would pull it out. So I would be putting it back in at home so that we didn't have to go to the emergency department, flushing her PICC line. All that stuff was stuff that I was doing. So it was just, like I said, that additional cognitive and emotional burden, even when my time was less taken up, I feel like the cognitive and emotional burden of that extra role was so high that I'm glad that I stayed part-time for as long as I did.
Yeah, I think for me, it was, when we initially got this diagnosis, right? Who has ever heard of polymicrogyria other than a neurologist? No one. So, and it obviously I was in a much better position than my husband and other family members or other people in our life to really understand the implication of this diagnosis. And, I remember when he was initially diagnosed, our pediatric neurologist, who was also a friend and co-resident formerly of mine, gave me this hug and said, the MRI is abnormal. We're going to be with you for the long term. And, although I knew the reality of this, this isn't just a blip and, you can't just cure this diagnosis, it was still very, very hard to hear. And, I think it took much longer time for my husband to ultimately understand the reality of what it would mean to have a child with profound disabilities. And then over time, our roles and, have, changed and adapted, and then he has been so wonderful with our son and has connected to this child on a level, that it just be present in a different way. And, of course, it's also been having advantages to be a neurologist and have the language available to me that other people might not. So I would say, yeah, it comes definitely with both challenges and also advantages. So as an example, when my son was admitted with the status epilepticus, I was able to, talk to a friend for sort of a second opinion, right? As it kind of goes, there's always lots of differences in opinion and what to be next. And so it was very helpful to kind of get sort of a curbside opinion. And I know, as Sarah said, sometimes we don't want to overdo it. We don't want to micromanage things. But on the other hand, it can certainly also be very helpful in certain situations.
You've alluded to this, and we've talked about interacting with the healthcare system and how specialized medical knowledge can be of benefit. But how else has this experience informed your perspective on navigating our healthcare system and what our patients and their caregivers go through?
Oh my God, it was a nightmare. I don't know if Catherine's had similar experiences, but like I said, I mean, sometimes I was dealing with multiple pharmacies, 3 or 4 pharmacies, a compounding pharmacy, some other pharmacy in Florida. Our insurance is basically an HMO type situation. And so even though she had to be airlifted to Boston Children's Hospital for transplant, subsequently, absolutely everything that happened at Boston had to be specially approved as an outside provider, trying to get in touch with our team, sending a MyChart message and it goes nowhere. It was infuriating. I mean, I remember talking to somebody who told me that tacrolimus had not been shipped because it wasn't approved. And is there an alternative for my infant daughter who just had a liver transplant? And I about exploded. I mean, I had people on the inside, I had the phone numbers of her providers, which I tried to use very judiciously. There was a pharmacist whose family member had had the same diagnosis. And I always went to him when things weren't going well from a pharmacy perspective. And he was wonderful. I was within the system that I was trying to navigate, and it was still a nightmare. So it's given me a lot of insight into what our patients and their caregivers go through and how difficult this would be without medical literacy. I can't imagine.
Yeah, unfortunately, my experience is not any better. And certainly, as Sarah said, it really, you kind of know it, that things are difficult, right, from a physician perspective, and you have to do peer-to-peer calls and prioritizations. But navigating it from a parent or caregiver perspective is really very difficult. And some people have asked, like, well, is your husband going to go back to work now? And I mean, if he wouldn't stay at home and actually do all these phone calls all the time, right? I mean, even if you have your prescriptions and everything in place and everything is standard, and, we get diapers as a medical supply, there's always things that fall through the cracks, and you have to make calls or you get overcharged, so it's just very, very difficult. And really to know the different language, the insurance language, is very challenging. And, also from a kind of a patient navigation perspective, as Sarah was saying, communication can be challenging. And then sometimes the need to see multiple specialists is just overwhelming. And I never use words like non-compliant anymore. And I think there's definitely been this, perspective, it's really often a structural issue, and the burdens we put and expectations we put on patients and caregivers that are just impossible to keep up. And just as a very small example, our neurologist at some point told us, you really should, the vitamin D levels are low. We need to do something about that to prevent osteoporosis. And so my assumption was just, well, he could write us a script, or his main pediatrician would write us a script. But no, he was referred to the special bone clinic that was in a far away part of town, and, required an extra half day to take off. And, we never went. So I ultimately just got the vitamin D over the counter, and we just started giving it to him. And it can sometimes sound ridiculous, but sometimes it's just the one too many things. We were lucky ultimately to move, one of the decisions that informed my latest career move was specifically to move to a state, so we're in New York now, where services for disabled people are generally better than in some other states. And unfortunately, not everyone has that luxury to just pack up their things and move states, but there are great differences to available care depending on what part of the country people live in.
In retrospect, as the dust has settled, the descriptions of your journeys can seem deceptively condensed. What would you say is a reasonable timeline for someone in a similar situation to expect to take to adapt their lives and their careers?
I think everybody's different. You're hearing two different perspectives right here. And I think everybody's going to be different in terms of what they need, and there are a lot of things to keep in mind. When I went part-time, I was like, what's the lowest I can go and still have insurance for myself and my family? That's a reality of what I had to think about. Oh, I just took maternity leave. So there was all of my FMLA for the year. How does that work? Home finances. Both of us now have stay-at-home dads. It sounds like both of our husbands had careers before with incomes and now don't. And so how do we support the family as well? How much do we need to do that? And then everybody's emotional reaction is going to be different. I still have a little bit of trouble walking past the pediatric surgical family waiting room in the hospital. I had to avoid it for a long time. I have trouble seeing transplant patients on the neurology consult service. All I can say is everybody's journey is going to be different, and give yourself the time that you need. And it's okay to do that. You're going to be a better doctor and a better employee if you come back refreshed.
Yeah, I would definitely second that. As Sarah said, it's going to be different demands and needs depending on everyone's situation. If you're caring with an elderly family member that requires caregiving, or someone with cancer versus someone with a lifelong disability. But, interestingly, I had learned a bit about grief just the year before our son was born, because I had lost my mother very unexpectedly. And, I think both of these events have just sort of taught me, grief is not following a linear trajectory, right? There's going to be, it's more like, people compare it more to waves in the ocean, right? They kind of come and go and might hit you unexpected and in unexpected ways. It's hard to generalize, but I think, looking at a family unit and how things might work out is also very dependent on what outside help is available or might become available. So there's certainly many different factors that play into one's decision making.
In hindsight, would either of you have done anything differently?
I think you just learn as you go. So it's really, if one thing I have really learned from this whole experience is you can plan life less than you think, right? I was on this trajectory. I had this endowed professorship at a very young age at an academic institution. I was very academically minded and doing all the things. But ultimately, I have, one could reasonably say I've taken a big step back in my career, but it really changes, things like that change your perspective so much. And ultimately you hear this from so many people, right? Because for all of us, as getting older means, dealing with unexpected illness and grief at some point in our lives for pretty much every one of us. And I think it changes your perspective on the balance of professional and personal life and how to kind of all make it work. But I think in the end, family ultimately has to come first. and I feel fortunate that I found a way to still have a full-time career to make positive impacts on many people's lives now in my community. But yet also be more available for my family.
For me, having that period of time after her transplant when I was part-time and home 1 to 2 days a week before she started school, I loved that time with her. And it was wonderful while my kids are young to be able to take a break in the middle of the week, really focus on them outside of the craziness of after work, dinner, bedtime, etc. And honestly, this isn't quite an answer to your question, but I would have done a part-time situation earlier for my son when he was younger, if I could go back in time, because I think irrespective of all of the medical stuff, it was very valuable for me to have that time. And with her, I think, I don't know if I would have done it differently. People asked me, why didn't you take off? Why didn't you stop working altogether? But I really felt like I needed the distraction. Honestly, I needed to continue working. I needed to feel like I was being productive and being useful and, seeing my patients. I needed to feel like I wasn't just wallowing at home, staring at the ceiling and thinking about what could happen. So it was the right decision for me.
Any final words of wisdom for our listeners?
Well, I think, with everything being said, we've talked a lot about the difficulties, obviously, of dealing with severe illness in a child. And again, similar things certainly applies for dealing with illness or other difficulties in other family members. I think overall, actually fortunate to be a physician. And I think our careers do allow for a relatively great amount of flexibility and career shift, right? As is sort of covered in other episodes of this podcast. So despite all the negatives being said of being a physician and having high burnout rates, we have actually ability to, work in a variety of clinical settings and non-clinical settings, industry, or, do consulting work. So I think it's sort of reassuring to kind of know, if circumstances change, if life changes, there are ways, to pivot, transition, and still work in the job that we trained for.
I absolutely echo that. You just have to, I guess, be brave enough to jump. I didn't jump anywhere, but I would say, in addition to that, if something like this happens, you will hopefully be at a place where you receive support from leadership, from colleagues. You shouldn't be asked to find your own coverage, figure out where the patients that have been canceled are going to go. You don't have the emotional energy for that, right? In situations like these. And I feel so blessed that the leadership at my institution just didn't ask questions. Even when a year later, when she got admitted to the PICU, I alluded to this earlier, with a hemoglobin of 4, I was on service. And I called my vice chair and I said, I'm on service. My daughter is going to the PICU. I don't know what to do. And he was like, you're not on service. I'm on service now, starting now. And that kind of support is out there. And it's necessary in these situations. And if you're not getting that kind of support, then it may be a good option to look for somewhere where you're going to have a little more flexibility and support.
And yeah, I mean, as maybe a final word, this certainly might sound very cliche, but I think it is just true for all of us. The more we deal with personal difficulties in our own life, it does certainly open our eyes and make us more empathetic to others' people's struggle. And, it's so easy sometimes to get frustrated in clinic, right? And people have demands from all sides and write inbox messages. But behind all that is usually a suffering human, right? Is an anxious human, is an overwhelmed person with a whole host of problems that we often are completely unaware of. And again, if nothing else, I try to always keep that in mind and temper my responses. If something is irritating, it probably just
hits on a deeper level. And I think seeing that and recognizing that is kind of a step to actually avoiding burnout and really just seeing people for, how they really are. They're looking for help and they're looking for answers as all of us do.
That's such an important point, and I completely agree with you.
I want to thank you both for joining me today. I want to say how grateful I am for both of you to share your experiences, and I feel very inspired by your strength, your perspectives, and also the hope that you offer for me and for our listeners in how we can approach our own lives and our own challenges as we navigate our careers in medicine. Thank you again.
Thank you for having us. My pleasure.
Thanks for having me.
Neurology Nuts and Bolts podcast was created and produced by Sara Schaefer. It is not recorded as an official podcast of any institution or organization. The podcast is unfunded. Opinions are those of the individual participants. Music by Audrey Nath. Artwork by Shivani Ghoshal. Want more content like this? Be sure to subscribe to the Neurology Nuts and Bolts podcast on Buzzsprout to hear more about constructing your career in neurology. Follow us on Twitter at Neurobolts and on Facebook at Neurology Nuts and Bolts to stay up to date on new content and give us feedback on what you want to hear. And tell your friends. Thanks for joining us.